Okay. Good afternoon. My name is Elizabeth Buller, and I'm the President and CEO of the Scarborough Health Network. Thank you for joining us today at our Birchmount Hospital. As we get started, I would like to welcome our special guests, Premier Ford, Minister Elliott, Minister Cho, MPP Aris Babikian, MPP Christina Midas, and MPP Vijay Thanigasalam. Thank you all for being here today and for your ongoing commitment to improving health care in Scarborough. I would also like to welcome our SHN Board Chair, Mr. Matt Ainley, our past Chair, Maureen Adamson, members of our Board of Directors, and importantly, our amazing staff, medical staff, members of our Patient Family Advisory and Community Advisory Councils, our Foundation President and CEO, Ms. Alicia Vandermeer, Foundation Board members, Cabinet Campaign members, and of course, our valued donors. As I reflect on the last 5 years, I am struck by how much we have accomplished together, beginning with a mandated merger to creating an integrated health network for Scarborough, our new name and brand, a 5-year strategic plan, and new and expanded clinical services and innovations, just to name a few. Despite the pandemic, Scarborough Health Network did not lose sight of our need to not only address the pressures of the pandemic on our community, but also to grow and meet the many needs. From integrating and expanding the programs to implementing the new EPIC clinical information system across the entire Central East region, truly transforming the patient experience and bringing us to the forefront of healthcare for the digital age, to establishing one of the largest Ontario health teams, and importantly, re-engaging and strengthening our relationship with our primary care physicians and our community agencies to better serve all of Scarborough where and when care is needed. Last June, we launched the Scarborough Research Institute. We became partners with the Toronto Academic Health Science Network, and most recently are pleased to be partnering in the development of the Scarborough Academy of Medicine and Integrated Health with the University of Toronto Scarborough campus. We have a lot to be proud of and much to be excited about. I would be remiss not to give a shout out to how much SHN, with our community partners, accomplished during this global pandemic in addressing COVID. I am so proud of our community's response to COVID-19 and full of gratitude for our physicians, nurses, allied health professionals, community partners, our Scarborough vaccine team, and our Scarborough Ontario Health partners. Also, the support of our government and the Ministry of Health, and of course, Scarborough, our community at large. As a healthcare leader in Ontario, there are a number of incredible things on the horizon, and today I am proud to be here to join in sharing much-awaited news that will shape the future of care for the Scarborough Health Network. As many of you will recall, after months of research and engaging with our stakeholders, we developed and submitted to the Ministry 3 options for future facilities. Additionally, we secured funding commitments to renew our emergency departments at our Birchmount and our Centenary hospitals, to move forward with our diagnostic imaging concourse at the General Hospital, and to forge ahead with the visionary Bridletown Neighbourhood Centre. Scarborough Health Network is leading the way in delivering accessible, world-class, and inclusive health care to one of Canada's most vibrant and diverse, yet vulnerable communities. Despite our incredible care, our facilities have suffered under the need for substantial infrastructure upgrades. As we cautiously move towards a post-pandemic world, COVID-19 emphasized the need to rebuild, renew, and expand our outdated hospital facilities to better care for our growing and deserved Scarborough community. So today, I am pleased to invite Premier Ford to share some very exciting news with us. But first, I extend a warm welcome to MPP Babikian for Scarborough Asian Court. Eris, you have been a tireless advocate for Scarborough Asian Court and for the Scarborough Health Network. Thank you.
Ladies and gentlemen, good afternoon. As the Scarborough Asian Court MPP, I am proud and humbled to be able to participate in this historic announcement. For too long, Scarborough Asian Court has been ignored. Not anymore. After 15 years of neglect, broken promises, and dilapidated infrastructure in Scarborough Asian Court and Scarborough, we are getting the attention we deserve. Under the leadership of Premier Ford and Minister Elliott, we are building Ontario to better serve the people of Scarborough North and Scarborough at large. Today is a landmark day for our residents. Many future generations will fondly remember and cherish this day. The wait is over. A new dawn is shining on our residents' life. It is my great pleasure to introduce a man of compassion, a man with outstanding leadership, and most importantly, a man who has deep love for Scarborough. Ladies and gentlemen, the Premier of Ontario, Doug Ford.
Thank you. Well, thank you so much, and good afternoon, everyone. And MPP back in, thank you for that introduction. You've been fighting for the people of Scarborough Asian Court and are a big reason why we're here today, and I just want to acknowledge our other MPPs that have been fighting for Scarborough as well. A great leader, and Minister Elliott, thank you for everything you've done over the last 4 years. And Minister Cho, I think you've been elected more times than anyone in the history of Scarborough, so congratulations on this. And Thanagaslam, MPP Thanagaslam and Midas, you've both been absolute champions for Scarborough Health Network. I want to thank Elizabeth, the team here at Birchmount Hospital, and the entire Scarborough Health Network for everything you do to serve this community. Friends, Friends, after 2 very long years, we've come so far because of the sacrifices made by every Ontarian and the amazing care provided by our healthcare networks. We've been able to safely and cautiously reopen our province. Our government has a plan to build a stronger, more resilient province with a health system that can respond to crisis. Our government has a plan to add the hospital beds and doctors, nurses, and personal support workers we need to ensure our province stays open. Today, as part of that plan, our government is delivering on our promise to bring real help to the people of Scarborough. We will be investing over $1 billion in a number of significant projects across the Scarborough Health Network. This investment, yes. This investment will support the building of a new hospital right here at Birchmount. It will also expand. Yeah. Boy, people are enthused, and yeah, rightfully so. You deserve to be enthused. It will also expand emergency care services at Centenary Hospital. Fund a new chronic kidney disease program at Bridletown Neighborhood Center, which is amazing as well, and modernize diagnostic imaging services at Scarborough General Hospital. The simple fact is, families across Scarborough need and deserve high-quality health care for their growing community. And at a time when our government is investing billions to expand subways and public transit, including by finally delivering a subway to the people of Scarborough, it's never been more important to also invest in this community's health care. For far too long, this community has been waiting for their fair share of rapid underground transit, their fair share of services, and most importantly, Scarborough has been waiting for their fair share when it comes to health care. Previous governments, they talked, they did studies, asked for report after report. The result was delay after delay as the people of Scarborough waited. My friends, the days of waiting are over because our government is getting it done. People in Scarborough have a very, very special spot in my heart. I know I had a very special spot in my brother Rob's heart as well. You've always supported me and my family, and I will always, always support the people of Scarborough. The new hospital expansion here at Birchmount will see a new state-of-the-art inpatient tower with more than 200 new beds, in addition to the brand new emergency department that is so badly needed. And once this major development is completed, Birchmount Hospital is planned to have over 450 beds, nearly doubling the current capacity. This will provide residents of Scarborough and the surrounding communities with improved access to the emergency care, surgery, and mental health care, as well as stroke and rehabilitation services. Previous governments were satisfied with making big promises and then delivering Band-Aid solutions that did nothing to address long-term needs of the rapidly growing population. But I'm here to say those days are over, they're done, because our government has a plan to invest more than $30 billion over the next 10 years to build and improve Ontario's healthcare infrastructure. That's the largest investment in healthcare infrastructure in Canadian history. And we're also providing an additional $827 million to publicly funded hospitals across the province. This represents a 4% increase from last year. It's all part of our plan to build a more resilient healthcare system to serve all Ontarians, a healthcare system that will allow us to stay open. My friends, in 4 short years, our province has come so far together. Let's keep building, let's keep investing in our communities, and let's bring the great people of Scarborough the hospitals they need and deserve. Friends, let's get it done. Thank you, and God bless the people of Ontario. Thank you. Now, thank you.
We'll now take questions.
Well, you can hear people are excited here.
We'll now take questions from media. If you have a question, please line up behind me at the mic, and it's 1 question, 1 follow-up. Thank you.
Thank you. Hi.
Hi.
The science table is going to be releasing new modeling numbers this afternoon. I'm just wondering what you're expecting to hear. Do you think we're still in the midst of a little spike, or do you have any concerns about what you're going to hear this afternoon?
What I'm hearing, some positive information about the wastewater test. It kind of peaked and it's slowly going down, but I truly believe everyone should continue to be cautious, move forward cautiously, and we've built up the hospital capacity. We're listening to Dr. Moore's recommendations, but this is an example of building the hospital capacity right here in Scarborough and across the province, adding 8,700 new healthcare workers, adding 3,100 new beds. We're prepared, but thank goodness we're seeing a little bit of direction going down.
Okay, and I actually wanted to ask you about your nephew, Michael
Yeah.
Ford, running provincially,
Sure.
and if there are any other Ford family members who might be running to replace him on City Council.
I can't, I'll never say no, but as far as I know, I'm going to say no for now. But Michael's done an incredible job down at City Hall. He has the experience. He was a school trustee, and then he was a counselor, I think, for 6 or 7 years, and he's passionate about serving the people. The people of York Southwestern have been ignored for last, God knows how long, eight years. Now they're going to have a voice. God willing, Michael gets elected, he'll be at their door supporting him and giving him the customer service that the Fords give the constituents.
Hi, Premier.
Hi.
We recently heard from Dr. Moore, and it sounded like he was getting ready to recommend that the April 27th date for mask mandates in places like this, hospitals, long-term care, be extended past April 27th. Is that something you're considering? Would you look at doing that?
I wouldn't have any problem at all with that. I really wouldn't. We want to protect the most vulnerable. I've always said that from day one. But I'll wait for Dr. Moore to give us the recommendations like I have right from day one. And if he gives us that recommendations, I'd be more than happy to do that. But most importantly, we have to take care of the most vulnerable. That's why we're giving the 4th doses out. That's why we have the antiviral pills for the most vulnerable and the capacity. And the hospitals are strong right now. I want to give a shout out to all the healthcare workers. They've been absolute fabulous. They're game changers. If we didn't have the quality of healthcare people in this province throughout this pandemic, we would be in deep trouble.
You also participated in a Ring of Fire announcement this morning, and it says announcement about terms of reference for an environmental assessment to build a road. That's a far cry from jumping on a bulldozer yourself and heading up there. Has your strategy changed in the past 4 years? Are you adopting more of a slow and steady approach to developing the Ring of Fire?
We're just strong believers in working with the Indigenous communities and with Webequie and Martin Falls and both Chief Cornelius and Chief Bruce. They've been great partners, and our goal is to continue building that road. We're going to be investing $1 billion into that road, and we look for partnership with our federal partners as well. There's amazing opportunity, not only just for the critical minerals, but to deliver fuel to the First Nations community up there. Right now, everything's being flown in. And the stories I hear right from their community members is they have to fly the fuel in, they have to fly food and fresh fruit, which is usually frozen by the time they get it, and then the health care as well. And when we build that road, they're going to be having access to the fuel, the proper food, nutrition, and proper health care. So we're really excited, and they're going to partner up with some private sector companies. And I've always said when we work hand in hand with the First Nations community, with the provincial and federal government, with the private sector, everyone really benefits. It creates a tremendous amount of employment for their communities, and they're just so excited. So we're going to make sure we continue on with the environmental studies. I imagine they'd probably take a couple of years, and it's going to change their lives. It really is. Not to mention the critical minerals that are going to go down to southwestern Ontario to go into the battery operations down there. So it's a real supply chain. It's amazing how everything is connecting.
Premier, all 3 scenarios that were submitted by this hospital to your government in 2019 included the rebuilding in the Centenary Hospital campus, as well as one other campus. Can you speak to Centenary and what is going to happen to Centenary?
Well, I can't speak directly about that. Maybe I could hand that over to Elizabeth, but what I can tell you, for the first time in decades, Scarborough's not being ignored anymore. We're investing over $1 billion into the Scarborough Health Network. We're making sure that they're going to be taken care of. We're adding the 200 beds, the emergency services as well, the diagnostics when it comes to kidney, any kidney diagnostics. But I'm not the expert. I'll hand it over to Elizabeth or the minister. Maybe they'll be able to.
Thanks, Mike. The Centenary is phase 2 of the redevelopment, so we have 2 phases that are committed in our master plan. Today we're pleasantly and welcoming the announcement of phase 1, which is the redevelopment of our Birchmount site and expanding that, and phase 2 will come down the road for the redevelopment and renewal of the Centenary Hospital.
Sorry, Minister, can you speak to the timing of that? Is that going to be several years after Birchmount, or?
It will be phased after Birchmount, and it may be phased alongside as the years go by, but we don't have an exact timing for that yet.
Thank you.
You're a minister
Got a promotion there. Premier Richard with City News. How you
Hey,
doing?
Richard, good. How are you?
Good. I think everyone agrees Dr. Moore has a right to take a vacation, but I would think Ontarians also agree they have a right to get an honest, straightforward answer out of their premier.
Sure.
Can you tell us why, when you were asked where Dr. Moore was last week, you said he was in meetings and working hard when he was actually in the Dominican Republic on vacation?
Well, I was honest. He was working hard. He communicated with me, with the Minister of Health. He communicated with his deputy. What I understand that he was working all the time there. And, you know, I just appreciate everything that Dr. Moore has done. He is a relentless worker, and he does a good job. We're taking his advice moving forward. He's got us this far. He's going to continue to lead on recommendations to the government, and I appreciate all his hard work.
All right. On another note, the government's fiscal year is over. We're, 20-some days from the election campaign. We still haven't seen your budget, which I think you're going to run your election on, sir. When is the budget coming, one? And number two, do you intend on passing that budget in the legislature before the election, Premier?
Well, just stay tuned, Richard. We'll be getting to that budget before we go to the polls. Just stay tuned. Thank you.
Good afternoon, Premier. Just to follow up on one of the earlier questions.
Sure.
So Dr. Moore is likely to recommend that mask mandates be extended for public transit. So can you explain what the logic is, why public transit makes sense and not schools, for instance, and crowded classrooms?
Well, again, we're going to take the advice off Dr. Moore. And, you know, I go back to the capacity that we have now compared to the beginning of this pandemic. We have the capacity in the hospitals. We've hired more healthcare workers. We have the antiviral pills. You know, we're doing fairly well as a province. You compare us to other regions, and in Canada, we have the lowest hospitalization rates. I think there's one or two smaller provinces that are just slightly lower. But we've been doing a great job. I encourage everyone to be cautious when you're in a crowded room. Yes, put your mask on. But the reason, you know, we aren't going into lockdowns is because the protocols that we put in place, the capacity and the infrastructure we put in place. So that's the reason we aren't going into lockdowns in the future. We're going to make sure that we continue building hospital beds, hiring more healthcare workers, more doctors, more nurses, more PSWs, and we'll have a stronger healthcare system now than we had before this pandemic started.
And maybe just ahead of Easter long weekend, what's your advice to Ontarians? Should they avoid gatherings? Are you going to be gathering with family yourself?
Well, I'd say stay cautious, right? Stay cautious. If you're having 15 people over, put your mask on, right? Like it doesn't hurt. If you're in a crowded room, just like we've been through this for 2 years now. It's common sense prevails, right? Put a mask on. It doesn't hurt. That's going to be up to each individual person.
Last question.
Hi, Premier.
Hi.
We heard from Dr. Moore on Monday that he's expecting ICU admissions to go up to 600 in this wave. Even though wastewater is improving, that could still happen. How are you so sure that the system can handle that number, a number we haven't seen before?
Well, first of all, you know, if we had to push the maximum, I'm going to hand it over to my Minister of Health. But if we need to max it right out, we can go as high as, I believe, close to 3,000 if we had to. But we aren't in that position right now. We're actually seeing positive results right now with the wastewater. And let's just hope it goes down, and we're going to be very, very cautious. And that's what we're going to take the approach moving forward. But I'll pass it over to the Minister of Health.
Well, the wastewater surveillance does seem to indicate that we have reached the peak, that we will start seeing the numbers go down. Of course, that doesn't happen immediately because hospitalizations are a lagging indicator. However, with the increase in the number of beds that we've created, the 3,100 beds that we opened up several years ago that remain in operation, with the staff that's been trained and with the rest of the work that's happening, we are sure that we will be able to handle any increases. We saw a huge surge during the third wave. We will be able to handle the numbers both in terms of med-surg beds as well as intensive care beds. Thank you.
And then for the Premier again, on the extension of mask mandates in public places like transit and hospitals, is there a time period that's not palatable? I don't know if we're talking about an extension of a couple weeks, if it's months, if it's into the summer. Is there a time for you that is too long to keep that going?
No, I'm going to listen to the advice of the chief medical officer, and which I always have, and I'm waiting for his recommendation. And once he gives me the recommendation, then I'll be able to answer that question.
Thanks, everyone.
Okay, thank you, everyone. Thank you.